Welcome back. Mental health professionals are in high demand throughout the country as the need for services grows. However, the shortage of providers is also growing. Human behavior is at the heart of many of the biggest issues that we're facing, like health, inequality, climate change. Now is a better time than ever to get involved in helping people with their well-being. Who better to talk about this is our 9 News wellness expert and licensed psychotherapist, Heather Hans. Good morning, Heather.
Good morning, Natasha. Great to be with you.
It's so good to have you. And so if people might be interested in joining your profession, what kind of issues do a mental health specialist work with?
Sure. So it's really any issue related to living life. So most commonly that would be stress, communication, boundaries, self-esteem or self-worth issues, inequality, trauma, addiction, or mental illness, and also life transitions. And then one of my favorites is the subconscious mind. And the public messaging about the importance of mental health has really been growing, and private equity firms are investing in it like we've never seen before. So it's really a great time to get involved for people who are interested.
And so someone who might want to get involved, how can people get involved, and are there ways to get involved without a degree?
Yeah, good question. So the traditional route is to become a state licensed mental health professional. That does require a degree, but if this is your passion, then it can really be worth the investment. And some of the more common types are psychiatrists, psychologists, clinical social workers, marriage and family therapists, and professional counselors and addiction counselors. They all require a graduate degree and clinical training and examinations, as well as continuing education. But for people who don't want to go that far and who have experience with a mental health condition or a substance abuse recovery, you can become what's called a certified peer specialist. And this is an evidence-based treatment where you basically mentor people who are going through what you've gone through. And there are job openings for them at universities, mental health centers, substance abuse treatment centers, nonprofits. It does require a little bit of training and certification, but nothing like getting a degree. And then if neither of these options work, there's always a need for volunteering and advocacy work in mental health. Sometimes it can be enough just to help someone in need, but you could also volunteer at a community mental health center. Every county has access to one, and you can find those online. You can get involved in public policy change. Educate people about stigmatizing language, educate yourself about mental health and its obstacles. And then, of course, you always want to work on your own mental health first and foremost.
It seems like there's a lot of different pathways. What's a good first step to figure out which one to take?
Sure. So I would recommend that people decide if there's a particular age or population or issue that you want to work with, and then just start doing a web search, make some calls, and find the right fit for you. And if this is your passion, you can find this to be a very rewarding field.
Great advice there. And you're right, we do need more mental health specialists, especially in this time. Heather, appreciate you coming on the show. Thank you so much.
Thank you so much, Natasha.